Let me ask you something that most doctors won't bring up, but I know you've been thinking about. Have you looked down recently and noticed that things just don't look the same as they used to? Maybe you've convinced yourself you're imagining it, or maybe you're too embarrassed to ask anyone about it. But here's the truth most men over 60 need to hear. Yes, your penis can appear smaller as you age, and no, you're not losing your mind. This is a real physiological change that happens to millions of men, and today I'm going to explain exactly why it happens, what's really going on inside your body, and most importantly, what you can actually do about it. I'm Dr. Julia, a board-certified urologist with over 30 years of experience helping men navigate these exact concerns. And I can tell you right now that while this topic makes most men uncomfortable, understanding what's happening is the first step to managing it effectively. Make sure you subscribe and hit that notification bell because the information I share on this channel could change how you feel about your body and your sexual confidence. Now, before we dive into the science, let me be crystal clear about something. This conversation isn't about feeding into insecurity or making you feel inadequate. It's about giving you accurate medical information so you can stop worrying and start taking action. Because here's what I see in my practice every single day. Men suffer in silence, convinced they're somehow broken or less masculine, when in reality they're experiencing completely normal age-related changes that can often be managed or even reversed with the right approach. The biggest misconception I need to address immediately is that your penis is actually shrinking permanently and irreversibly. That's not accurate, and it's causing unnecessary anxiety for millions of men. What's really happening involves several interconnected physiological changes that create the appearance or sensation of reduced size. Let me break down the actual mechanisms so you understand what's going on. First, testosterone decline plays a massive role. Your testosterone levels peak in your 20s and then gradually decrease by about 1 to 2% per year after age 30. By the time you reach 60, you might have 50% less testosterone than you did at your peak. This hormonal shift affects everything from muscle tone to blood flow to tissue elasticity in your penis. Lower testosterone means reduced blood flow to your erectile tissue, which can make your penis appear smaller both when flaccid and when erect. Second, vascular changes significantly impact how your penis looks and functions. The small arteries that supply blood to your penis become less flexible with age. They can develop plaque buildup, narrow, and lose their ability to dilate fully. This reduced blood flow means your erectile tissue isn't getting filled to capacity like it used to. Think of it like a balloon that's only partially inflated versus one that's fully expanded. The balloon hasn't shrunk, but it certainly looks smaller when it's not fully filled. Third, and this is the change most men don't realize is happening, abdominal fat accumulation creates a visual illusion that dramatically affects perceived size. As men age, even if they maintain the same weight, fat distribution shifts. You start accumulating more visceral fat in your lower abdomen and pubic area. This fat pad literally obscures the base of your penis, making it appear shorter than it actually is. For every 30 to 50 pounds of excess weight, you can lose approximately 1 inch of visible penis length, not because your penis shrank, but because it's partially hidden by fat. Fourth, the ligaments that anchor your penis to your pubic bone can stretch and weaken over time. This can cause your penis to retract slightly, sitting closer to your body than it did when you were younger. And finally, actual tissue changes do occur. Collagen and elastin in your penile tissue break down with age, just like they do in your skin. This reduces elasticity and can cause some minimal actual shrinkage in rare cases, but we're typically talking millimeters, not inches. The key point I need you to understand is that most perceived size reduction is about blood flow, fat accumulation, and visual obstruction, not actual permanent tissue loss. And that's incredibly important because those factors can be addressed. You're not stuck with this. You have control over many of these variables. When men come into my office concerned about size changes, the first thing I do is assess their overall vascular health, hormone levels, and body composition. 9 times out of 10, we find that improving these factors leads to visible improvements in both flaccid and erect size. Now, before we talk about solutions, I need to warn you about something that makes me angry as a physician. The penis enlargement industry is filled with scams, dangerous products, and outright lies designed to exploit your insecurity and take your money. I've seen men damage their penile tissue with sketchy pumps, waste thousands on worthless pills, and even suffer serious injuries from untested devices. Please hear me clearly. There is no magic pill, no miracle cream, no device you can buy online that will permanently increase your penis size. Anyone telling you otherwise is lying to make money off your vulnerability. What does work is addressing the underlying physiological factors we just discussed. Let me give you a practical, science-based approach to managing and potentially reversing the appearance of reduced size. First, cardiovascular exercise becomes absolutely critical. Your erectile function is entirely dependent on healthy blood flow. The same factors that cause heart disease, clogged arteries, and strokes also affect the tiny blood vessels in your penis. In fact, erectile issues are often the first warning sign of cardiovascular problems because penile arteries are smaller and get blocked first. Regular aerobic exercise, walking, jogging, swimming, cycling, improves blood flow throughout your entire body, including to your penis. Aim for at least 30 minutes of moderate cardio 5 days per week. Men who maintain consistent cardiovascular exercise report better erectile function and more consistent size, both flaccid and erect. Second, lose the abdominal fat. This is non-negotiable if you want to see improvement. Remember that fat pad obscuring your penis? Every pound you lose from your midsection literally reveals more of your penis. I've had men lose 30 to 40 pounds and suddenly discover they gained an inch of visible length. Their penis didn't grow, it was always there, just hidden. Focus on reducing processed foods, sugar, and excess calories. Combine that with the cardiovascular exercise we just discussed and you'll see changes within months. Third, strength training supports testosterone production. Resistance exercises, particularly compound movements like squats, deadlifts, and bench presses, stimulate testosterone release. You don't need to become a bodybuilder, but incorporating strength training 2 to 3 times weekly can help maintain and even boost testosterone levels naturally. Fourth, optimize your diet for vascular and hormonal health. Foods rich in nitric oxide precursors improve blood flow. This includes leafy greens, beets, pomegranate, watermelon, and dark chocolate. Foods high in zinc support testosterone production. Oysters, pumpkin seeds, beef, and chickpeas. Healthy fats from avocados, nuts, olive oil, and fatty fish support hormone production. Your body needs fat to make testosterone, but it needs to be the right kinds of fat. Fifth, address sleep quality because testosterone production happens primarily during deep sleep cycles. Men who consistently get 7 to 8 hours of quality sleep maintain significantly higher testosterone levels than those who sleep poorly or insufficiently. If you're sleeping 5 to 6 hours nightly, you're sabotaging your hormone production and your sexual function. Sixth, manage stress aggressively. Chronic stress floods your system with cortisol, which directly suppresses testosterone and constricts blood vessels. Find stress management practices that work for you. Meditation, deep breathing, hobbies, time in nature, whatever brings you genuine relaxation. This isn't optional if you want to maintain sexual health. Now, if you're serious about implementing these strategies and you want to see real improvement, type "reclaim" in the comments and let me know where you're watching from. I want to see how many men are ready to take control of this instead of suffering in silence. Seventh, consider getting your hormone levels tested. If your testosterone is clinically low, not just on the lower end of normal but actually deficient, hormone replacement therapy might be appropriate. But this requires medical supervision and proper testing. Don't self-medicate with sketchy products online. Work with a qualified physician who specializes in men's health. Eighth, quit smoking and limit alcohol if you haven't already. Smoking damages blood vessels throughout your body, including in your penis. It's one of the strongest risk factors for erectile dysfunction. Alcohol in excess suppresses testosterone production and impairs sexual function. Moderate consumption might be fine, but heavy drinking is devastating for male sexual health. Ninth, stay hydrated. Dehydration reduces blood volume, which affects circulation and can impact how engorged your erectile tissue becomes. It seems simple, but many older men are chronically dehydrated without realizing it. Aim for adequate water intake throughout the day. And finally, maintain sexual activity. Use it or lose it is actually scientifically accurate when it comes to erectile function. Regular erections, whether through intercourse or masturbation, keep blood flowing to your penile tissue and maintain its health. Men who remain sexually active throughout their lives maintain better erectile function than those who stop. Now let's address the psychological component because this is just as important as the physical factors. Many men tie their entire sense of masculinity and self-worth to penis size. This is understandable given cultural messages, but it's also destructive and inaccurate. Your value as a man has nothing to do with the measurements of your anatomy. Your worth comes from your character, your relationships, your contributions, and how you treat others. Sexual satisfaction in relationships depends far more on emotional intimacy, communication, attention to your partner's needs, and mutual respect than it does on size. Study after study confirms that most women prioritize emotional connection, foreplay, and overall attentiveness over penis size. If you're in a relationship and you're worried about what your partner thinks, have an honest conversation. You might be surprised to learn they're not nearly as concerned as you are. If you're single and worried about intimate encounters, remember that confidence, communication, and genuine care for your partner's experience matter infinitely more than anatomy. The anxiety you feel about size often creates more problems than the actual size itself. Performance anxiety causes blood vessels to constrict, which creates a self-fulfilling prophecy where worry about your erection actually prevents you from achieving one. Learning to let go of that anxiety through the physical strategies we discussed, combined with psychological reframing, can transform your sexual experiences. I also want to address something I see frequently in my practice. Men who become so fixated on this issue that it damages their mental health and relationships. If you find yourself obsessing over your penis size to the point where it's affecting your daily functioning, your mood, or your relationships, please consider speaking with a therapist who specializes in men's sexual health. There's no shame in getting support for something that's causing you distress. Body dysmorphia related to genital appearance is real, and it can be treated. Now, let me give you realistic expectations about what following these recommendations can achieve. If you implement these strategies consistently, exercise regularly, lose excess abdominal fat, optimize your diet, fix your sleep, and manage stress, here's what you can expect. Within the first month, you'll likely notice improved energy levels and mood as your sleep and stress improve. Within 2 to 3 months, if you're losing weight, you'll start seeing more visible length as the fat pad shrinks. Your erections may become firmer as cardiovascular health improves. Within 3 to 6 months, with consistent effort, most men report significantly better erectile function, more reliable morning erections, improved firmness during sex, and a noticeable increase in visible penis size, both flaccid and erect. Some men report gaining an inch or more of visible length simply from weight loss and improved vascular health. This isn't magic. It's your body responding to better care and revealing what was always there but obscured by poor health. After 6 months to a year of maintaining these habits, the improvements typically stabilize and become your new baseline. At this point, you're not just managing age-related changes, you're actively reversing many of them. But here's the critical part. This requires consistency. You can't do this for a month, see some improvement, and then stop. These need to become permanent lifestyle changes. Your body responds to how you treat it consistently over time, not to short bursts of effort followed by neglect. I've seen men in their 70s recover erectile function they thought was gone forever simply by losing weight, exercising regularly, and managing their health properly. Age doesn't have to mean sexual decline if you're willing to do the work. Now, I want to circle back to something I mentioned earlier about scams and dangerous products. You will encounter ads promising instant results, miracle growth, or revolutionary breakthroughs. Every single one is designed to exploit your insecurity. Penis pumps, if used correctly under medical supervision, can help with temporary engorgement and might be useful for certain medical conditions, but they don't create permanent size increases. Pills and supplements marketed for enlargement are unregulated and unproven. Many contain hidden ingredients, including prescription medications at dangerous doses. Surgical procedures for lengthening or girth enhancement carry serious risks of scarring, deformity, loss of function, and complications. They should only be considered in extreme cases under the care of a specialized urologist, and even then, the results are often disappointing and the risk significant. Save your money. Save your health. Focus on the evidence-based strategies we've discussed. They cost little to nothing, they improve your overall health, and they actually work. Finally, let me say something about aging and acceptance. Yes, your body changes as you get older. That's inevitable. But those changes don't define you, and they don't mean your intimate life is over. Some of the most satisfying sexual relationships happen later in life because people have learned to communicate better, they're more comfortable with themselves, and they prioritize emotional intimacy alongside physical pleasure. Embracing aging while actively managing your health is the balance you're looking for. You don't have to accept decline as inevitable, but you also don't have to fight your body or feel ashamed of natural changes. Understanding what's happening, taking practical steps to optimize your health, and maintaining perspective about what really matters in relationships, this is the path to continued sexual satisfaction and confidence as you age. If you've stayed with me through this entire conversation and you're committed to implementing these strategies starting today, type confidence in the comments along with Dr. Julia, I stayed until the end. Let me know you're ready to take control. Share this with any man who's struggling with these concerns because most are suffering alone, too embarrassed to ask for help. Hit subscribe for more honest, science-based advice about men's sexual health. I'm Dr. Julia, and I've dedicated my career to helping men understand their bodies and maintain sexual function throughout their lives. These strategies work when you commit to them. Your body can respond. You just need accurate information and the discipline to follow through. With that said, thanks for watching, and I'll see you until next time.